All right, let's jump right in. In this explainer, we're going to walk through the entire journey of surgically treating that nagging, painful condition we all know as acid reflux, or GERD. If you've ever dealt with that awful burning feeling of heartburn, you are definitely not alone. It's estimated that as many as 1 in 3 people in North America experience it. I mean, that's a huge number of people. So, what exactly is GERD? Well, it's way more than just a little indigestion after a big meal. The official definition calls it reflux that causes troublesome symptoms or even complications. Think about it. It's like your body's internal plumbing has decided to start working in reverse, and not just once in a while, but all the time. To really get what's going on, we have to look at the body's own natural defense system against reflux. It's basically a muscular valve that's supposed to act like a super effective gatekeeper. This little muscle is called the lower esophageal sphincter, or LES for short, which is way easier to say. Its whole job is to be a one-way gate. It opens up to let food into your stomach, and then it's supposed to snap shut to keep all that stomach acid right where it belongs. So here you can see the difference. On the left, in a healthy person, that gate is sealed up tight. But on the right, with GERD, that barrier just isn't working. Either the valve itself has gotten weak, or an issue called a hiatal hernia is messing things up, where part of the stomach pushes through the diaphragm. Either way, the gatekeeper has failed at its one job. And that failure puts a lot of people at a major crossroads. Do you just keep managing the symptoms every day with medication? Or do you opt for a surgical procedure to actually fix the broken gate? And that is a totally fair question. You're probably thinking, hey, there are a lot of really good pills out there, like PPIs, that control the acid, so why on earth would anyone choose to go under the knife? Well, it's interesting because the reasons have really changed over the years. It's not always because the medication has stopped working. For a lot of people, especially younger, healthy folks, it's about wanting a permanent, long-term fix. I mean, who wants to face a lifetime of taking pills every single day, with all the costs and potential side effects that come with it? Okay, so for those who do choose surgery, what's the game plan? Well, before a surgeon even thinks about operating, they have to create a super detailed blueprint of the problem. You absolutely have to know exactly what you're fixing. And this part is absolutely non-negotiable. A successful surgery always starts with a really thorough evaluation. Just talking about your symptoms? Nope, that's not going to cut it. You have to get the full picture of each person's unique anatomy. This whole evaluation basically rests on 4 pillars. First, an endoscopy, where they take a camera and look inside. Second is manometry, which is a cool test that actually measures the muscle strength, the squeeze, of your esophagus. Third is the gold standard, 24-hour pH monitoring, which tracks exactly when acid is refluxing. And finally, some imaging to get a clear map of the anatomy. Altogether, these tests create that crucial blueprint. So with that perfect blueprint in hand, the goal of the surgery becomes crystal clear. It's time to rebuild that broken gatekeeper. The main procedure is called a fundoplication, and it's actually a pretty brilliant solution. The surgeon takes the upper part of the stomach, called the fundus, and gently wraps it around the lower part of the esophagus. This creates a brand new natural barrier that reinforces that weak valve and physically stops the acid from coming back up. But it's not a one-size-fits-all kind of thing. The surgeon customizes the wrap. A Nissen is a full 360-degree wrap. It's the most effective, but it can sometimes make swallowing a bit tricky at first. So for patients whose esophagus muscles are a little weaker, they might do a partial wrap, like the Toupet, to get the job done without making it too tight. Okay, the fix is in. The barrier has been rebuilt. So, what's life actually like on the other side? Let's talk about the results. And the results are honestly pretty incredible. The long-term success rates are really high. Just look at this. Even 10 years down the road, about 90% of patients are still getting major relief from their reflux symptoms. For so many people, that is completely life-changing. Now, of course, you've got to have realistic expectations about recovery. Most people are home in just a few days. You'll be on a liquid diet for a bit, and yeah, it's pretty common to have some mild trouble swallowing at first because of the swelling. That's all a totally normal part of the healing process. But at the end of the day, this is what it's all about. This is the goal. The vast majority of patients report that their quality of life is dramatically better, sometimes even back to normal, because they're finally free from the constant pain and worry of GERD. So that kind of leaves us with one last thought. Even with these amazing success rates, the surgery itself isn't the whole story. Its success is really a testament to the entire journey, from getting that meticulous diagnosis to having an expert surgeon, and then the patient being committed to recovery. It proves that for the right person, this isn't just an operation. It's the start of a whole new chapter.